Welcome to Exploring Tissue Texture, Part 2. We are now on page 13. I was ahead of myself. Okay. We are now on page 13. So tendons, ligaments, fascia, bursa, all of that kind of thing. So if we're starting with tendon, tendon attaches muscle to bone. So in the last video, we talked about muscle and we were palpating the muscle, specifically the muscle bellies, okay? Now, as we work our way towards the distal end of a muscle, so the part furthest away, we can start to feel where it becomes tough and maybe stringy. That part is going to be the tendon. So I'm going to put my video down here for just a second, get my face out of the way. If we talk about biceps here, this is the big bulky one right here. Biceps has a really great tendon for palpation. So you feel the muscle belly. It's pretty thick, right? You can squeeze it, you can make it bigger and more impressive looking, right? But as we work our way down towards the elbow, it starts to get stringy and thick, and it really feels very tough. It almost feels like bone. It's not bone. Right in here, this area right here, is the bicipital tendon, and it's big. Okay, and I'm trying to move it for you a little bit. You can see the bicipital tendon right there. It is right here, okay? Twang, twang, twang. Feels very much like a guitar string, very hard in there. And that's a typical tendon. Tendons can be long and thin. They can be short and tough, but tendon attaches muscle to bone, okay? Ligament, on the other hand, attaches bone to bone. That's the distinction. Tendon and ligament sort of feel the same as far as palpation is concerned. They're both cartilaginous and tough and thick, but ligament attaches bone to bone and tendon attaches muscle to bone. So if we're talking about where we can feel ligaments in the body, probably the best place to do that would be in the ankle, where there's not a whole lot of tissue. Maybe in the wrist here, you'd be able to feel some ligament if you have real skinny wrists, kind of like I do. But quite honestly, it's difficult to distinguish from other tissue, primarily because it's so deep. Obviously, if it's attaching bone to bone, it's going to be deep to muscles and blood vessels and fats and fascia and all of that kind of thing. Okay, so we're not going to be worrying about palpating ligaments so much, just because they're deep to everything else. Okay, there are certain places on the body where I will have you palpate ligaments, but we'll get to that when we're doing specific body areas. Okay, just know that they feel a little bit like tendon. All right, so if we turn the page, then we are going to be on page 14, and I'm going to bring the book back up. Actually, I should just skip to page 14. That would be easier. There we are. Let's talk about fascia for a minute. Fascia is connective tissue. It is arranged in sheets. And these sheets are either superficial or deep. The superficial fascia is located just below the skin. So here's the skin and here's the superficial fascia. And the superficial fascia kind of anchors the skin to the rest of the body, but also allows the skin to slide, right? Like we saw before. So when we lift the skin up, we're lifting it off of the underlying structure, which is the superficial fascia. This illustration is a cross-section of the forearm. So what I'm showing you here, if you would cut it right here and then look straight down in, this is what you would see. So you have two bones in here. You have all of these different flexor and extensor muscles, and you can see that they are all separated by fascia. So this is all the deep fascia. And like I said, fascia surrounds different muscles and even travels within the muscle itself to compartmentalize things. But it also helps muscle to slide past one another. So whenever you contract a muscle, the muscle has to shorten, but because it's shortening, it's also sliding over the structures that are located next to it. And if we did not have the fascia there allowing that sliding, our muscles would get stuck together quite a bit and we'd have a hard time moving, and that wouldn't be good. So fascia has a lot of different functions, and those are just a couple of them. As to what it feels like, that's a little tougher. Fascia is difficult to palpate in that most of it is rather deep, except for the superficial layer, and it is hard to differentiate from the skin because we know that the skin is pretty flexible. Fascia is too. So what instead, when we want to explore fascia, we do certain exercises like in your book on page 15. So one of the things that we do is we pull up the skin on the back of the hand here. Okay, just like this. Now we have the skin, but remember it's attached to the superficial fascia. So because it is, we try to do things like moving our hand, and it becomes a little more difficult because we're holding the connective tissue and not allowing that movement. Okay, so we can feel some of the underlying fascia when we move our hand. We can also do things like figure 0.23, where we actually draw an X on our forearm, and every time we move the skin very lightly in one direction, we can see which direction that X pulls. So we know which direction the fascia is moving. And you don't have to pull real hard. You're just gently moving the skin. Okay. Those are the types of exercises that you can do to palpate your own fascia, or maybe even on someone else. You will have a class that is dedicated to connective tissue later on in the program. So you're going to be able to feel fascia, even if you don't think you can at the moment, okay? All right, so the next type of tissue is retinacula. And retinacula is singular for retinaculum. I'm sorry, it's plural for retinaculum. I misspoke. Retinaculum is the singular. Retinacula is the plural. Sorry. So a retinaculum actually holds tendons in place. They're kind of like Band-Aids internally. And what they do is they hold tendons down. And that's about it. That's their only job. They hold tendons in place. They are superficial and they are accessible, but since there is so much going on in an ankle or a wrist where you have retinacula, it's very difficult to palpate them individually. But I just want you to know that they are there. And sometimes you can feel them because they do run in a different direction from the tendons. In fact, retinaculum means halter, band, or rope. And it comes from the Latin. See the L there? It comes from Latin. I'd mentioned that in our midterms video, that your book tells you where the root word comes from, what language. Okay, so turning the page, we have arteries, veins, bursa, and other tissue types. Now, arteries and veins are kind of easy to distinguish, specifically arteries, because arteries have a pulse. So if you're palpating your partner in class, or if you're palpating someone at home and you feel a pulse, you're on an artery and you should get off of it, Okay. There are arteries that are superficial, and there's some that are deep, and some that you won't know that you're on. But in general, the rule of thumb is if you feel a pulse, get off of it. You're not supposed to be working directly on arteries or veins specifically. So that's how you can feel that. Also, in the neck here, I don't know if you can see my neck. Get a little closer. I have, most people do have rather superficial jugular veins. You can actually see them right under the surface of the skin. And if you can see a vein, even if it doesn't have a pulse, because veins do not, you can avoid it, okay? Or you can very gently palpate it. It's so light and gentle that as soon as you press on it, it disappears. So when we're palpating in class and you are on an artery or vein, again, just move slightly off of it, okay? So that you're more on the muscle and less on the blood vessel. Bursa. Bursa are like internal water balloons. They're fluid-filled sacs, and they are located anywhere where structures rub together, because what they do is they reduce friction. So they're internal water balloons that reduce friction. That's my definition, and I'm sticking to it. Bursa are very difficult to palpate as well because they are deep to these structures. So they'd be deep to tendons because they prevent tendons from rubbing over the underlying structures. See, tendons are kind of like rope in that if they rub over things too much, they're going to fray and could possibly tear. So instead, we have bursa that prevents that from happening. The only time that you might really be able to palpate bursa is if they are inflamed and someone has bursitis. Then they can be really big and puffy, but otherwise, they're not really palpable. Nerves and lymph nodes. Okay, so nerves generally are not palpable either. However, when you are palpating on your partner or on yourself, and let's say you're in the neck, which is where these nerves are, and you press in there and you press maybe a little too hard, you'll get a zing sensation that radiates away from where you just pressed. If that happens, that means that you did hit a nerve, either, like I said, on yourself or on your partner, and you need to move your fingers off of that structure. Generally, your partner will tell you, oh, hey, that just made a zing, and you can avoid that area. So that's really what it feels like to be on a nerve from your partner's perspective. You yourself will not really be able to palpate that nerve. It's just too small, okay? But your partner certainly will know if you are on one. Lymph nodes, these can be palpated in some areas, but in general, they're not palpable either because they're deep. Lymph nodes feel like little peas right underneath the skin. So they can be large, most of the time rather small, and they actually can move around a tiny bit. So I'm going to stop the share for a second. I have superficial lymph nodes in my neck. And typically when students work on me, they're not sure what they're feeling because they've never felt one before. So at some point you will get to work on me in class, though it probably won't be for a while, and I will point them out then. But where's my superficial node? There it is. Okay, so right about there, you can see there's maybe a little bump right there. My finger's directly on it right now. If I move my finger off of it, you can see that there's a little bump there. Now, if you were working on me and you felt that, you would also note that it does kind of move around a tiny bit. That texture and the fact that it moves tells you that it's a lymph node rather than a knot in a muscle. Okay, it's going to feel like just a little bump in there. Okay, and I have one in the same spot on the other side, right there. So if you haven't been able to feel a lymph node on yourself or on your partner, you will eventually. Now, lymph nodes do not need to be worked out. Of course, they are there for a reason. Lymph nodes are filters. Okay? They filter things and move lymph around in the body. And again, we'll talk about that in more detail much later. And last, but certainly not least, at the bottom of this page, you have a blue box or a bluish gray box that talks about adipose. Adipose is fat. It's fat tissue. It is a form of connective tissue, and it's all over the body. You have a layer of fat directly underneath your skin. You have layers of fat that insulate your internal organs. You have layers of fat that actually surround nerves. Adipose tissue is necessary for the functioning of the body. The problems occur when we have too much adipose tissue. Then it can start to be harmful to health. But in general, adipose is absolutely necessary to the functioning of your body. As far as what adipose feels like, well, it's squishy, it's gelatinous, it moves around, sometimes it's lumpy. You can easily palpate adipose because you have it in different areas of the body. In fact, if you're sitting watching this video, then you can, well, maybe if no one's watching, you can feel around to your buttock area and you should be able to feel the adipose because it's superficial to the muscle there. Also, if you are female and you have breast tissue, that's mostly adipose tissue as well. So you can palpate those textures in those two places on your own, maybe when no one's watching. Okay. That is it for the tissue textures and exploring these different textures. We will be doing more palpation in class, of course, but we're going to be focusing on the muscles themselves. So I encourage you to palpate as many people as possible between now and then, maybe family members, pets. You can easily palpate a dog. Cats are iffy. They may let you, they may not. It just depends on the cat. You know, to get a sense of the different textures of these tissues on many different bodies, whether they're human or animal, doesn't really matter. It's all the same. All right, have a nice afternoon.